I'm Dr. Lochala, and I'm here today with Dr. Clevenger, our neurologist at Unity Health, and we were wanting to have a conversation today about migraine headaches. It's a common problem we see in our offices. It's a common problem for emergency department visits, and I'm honored to be here today with Dr. Clevenger and just review migraine headaches and what we can do to help prevent and treat this common medical condition.
Thanks for having me back.
Dr. Clevenger, let's start off with let's describe what migraine headaches are.
Okay. Migraine headache is just a headache that's usually a severe headache. It's usually associated with nausea or vomiting, oftentimes lighter sound sensitivity. Typically they're one-sided. They don't have to be. They can be on both sides, but usually they're one-sided, but they're a more severe headache, not just a mild headache.
What's the frequency of migraine? Of your typical migraine patient, how many migraines, let's say a week or month?
I would say migraine headaches probably make up about 30% of our patient population, in a given week. It's a very common problem.
Wow. And these often debilitating headaches, what can people do to help prevent them?
The first thing they can do is just keep a headache diary, write down their headaches, and then when they have a headache, just try to identify anything that they think possibly could have triggered the headache. You can just simply Google triggers for migraine headaches, or there are resources available. But a lot of these triggers are surrounding your sleep habits, what you eat, activities you do. For women, oftentimes it's their menstrual cycle. It can be certain medications. There's just a lot of different triggering factors. And so if you can identify those factors, then you can start there in order to reduce the frequency of the headaches.
Can you give us some advice on when a patient needs to present to the emergency department? Is there a threshold, or what's things to do prior to going to the ER or to the doctor's office? What can you do to try to prevent that, and some more available treatments for patients without an ER visit?
Mm-hmm. Well, of course, depending on how long the patient has had headaches. As patients have more headaches, they become more experienced, they feel more comfortable maybe not going to the emergency room. I can see where a patient with their first bad migraine headache might be more scared and might go to the emergency room. But if you're talking about a patient who's previously had headaches, then usually we recommend going ahead and taking the medicines that they've taken in the past, going ahead and laying down, trying to get sleep. Oftentimes just going to sleep will alleviate the headaches. If they have nausea, vomiting, taking medicines to control that. Those medicines by themselves have been shown to actually make some migraine headaches go away, even without taking an associated pain medication. So all those things can be tried initially. And then if the headache just simply won't go away, or it's increasing in intensity, or this is the first patient's first headache and it's a severe headache, then they probably need to go to the emergency room.
That's good advice. We've also had some recent innovations in migraine treatment that are really exciting. Right. Can you talk a little bit about those?
We've had good treatments for the last 10 years, but we do have some more good treatments at this time. Just within the last year or two, a new class of medicines called CGRP receptor antagonists are now available. And initially those came out as injectable medicines, and those still exist. Those are given once a month by the patient. So they come in an auto-injector. The patient gives the injection to themselves. They're easily administered. They work quite well. Recently, that same class of medicines has come out in oral form, and they can be taken acutely for a headache when the patient feels the headache coming on. But just recently, one of those medicines received an indication where you will actually take the medicine as a preventive medicine, so you can take it every other day.
Wow.
And it will reduce the frequency of headaches. And then when you get a headache, if it's a day when you didn't already take it for prevention, you can still take another one for the headache.
Wow, that is such great news. Migraine headaches are a common cause of missing work, missing out on life, missing out on birthdays that you plan to attend, and holidays and weddings and all of these things that we just value in our lives, and a migraine headache hits. And it really it's frustrating for patients, it's frustrating for physicians, and to have some newer treatments available is really exciting, because that impacts how somebody feels. I mean, that impacts their life.
Absolutely.
Well, Dr. Clevenger, thank you so much for being here today and just describing migraine headaches and having that discussion. And if you are bothered with migraine headaches, if this is something that you have considered seeing a physician about, you're welcome to come see Dr. Clevenger at Unity Health, and Mr. Andy Justice is there as well, and we'd be more than happy to see you and do an evaluation and find the appropriate treatment for you.